We started tracking it at that time, and our infection prevention folks and others started looking at it. We had already started our incident command process in place, had educated all of our executive leadership team.
You have to have a different kind of mechanism within the hospital to make very rapid decisions and to improve communication. We came up with a team that worked on making a surge prediction model. This model was used to predict what kind of resources we would need to meet that surge.
First and foremost, we knew that we needed to figure out how to keep our people safe. And equally with that, we knew we needed to learn how we could keep our patients safe and our community safe.
You have to decide what you can provide for in a health system, and then what you can staff for and what you can have appropriate PPE supplies to manage.
So with COVID-19, it's one of those things that as a nurse, you're always prepping for what if something happens. And being on the front lines, it's something like we've never experienced before.
We had a need for our employees to be at work caring for patients when in fact many of them had children at home that also now were at home.
So many people have come forward to give donations of personal protective equipment, N95 masks. An anonymous donor who brought ventilators to us when we were in need of that. It just fills my heart to think that we live in a community that is coming together and continues to come together to really act as a singular unit to be able to really protect all of us together.
Our focus is on taking care of the patients as they need us. Our focus is on our community. And in order to do that, we need every team member in the right place at the right time, doing the right thing in response to that community need.
It's really been special to have the people we work with here every day to be able to support us, because you don't leave here not feeling supported.
Pandemics are not something that we as a healthcare system alone, when we are trying to take care of a community, can handle on our own. And so it really took a lot of partners, and it's still taking a lot of partners for us to be able to continue to work together. So public health within the city of Neenah and Appleton and many other cities around us that we are a part of, in Chano and Wapaka and Berlin, working with public health there.
The camaraderie and teamwork has been absolutely amazing. I always say that teamwork in nursing, it is collaboration. You don't get into nursing to be alone. You're always with a team. During this time, I feel like I've worked with a great team, but it's just amped up even more.
As we back off on social distancing and start interacting with each other more, we just have to really keep a close eye on what that means for the incidents for the community.
We have to make sure that we continue to use the basic principles of hand hygiene and keeping distance at 6 feet or more, covering ourselves with face masks, and then hopefully treatments that potentially could help, and or a vaccine hopefully in our future. We've had tremendous leadership from our board who've been extremely supportive of me and our team at ThedaCare to be able to really develop a world-class organization in our communities and to position ourselves in the best possible way to have been ready for something like this.
The thing that I'm most proud of with the ThedaCare team is just the intensity of focus to get the job done and to get this health system prepared to help protect the community.
I think we take into the future that we are capable, we can do things very rapidly, we're agile, and we have to do that as a system and together, leaning into each other. We are better together than we are separate.
My hat's off to the people at ThedaCare, the leaders at ThedaCare, the clinicians at ThedaCare who have just done an unbelievable amount of work to be able to be prepared for the safety of our caregivers, the heroes that have been at the front lines, and for the communities that we're here to serve.